so because this particular issue is one of those issues but then it is what it is, and then in some air cost in year. Now you're moving on straight to the camp of a Komfo Anokye Teaching Hospital. One of the things you have to realize within this week is there's been a growing tension between the health ministry and also the Komfo Anokye Teaching Hospital. Ne fari by ni and as the kofa by ni na say ye wo ho and na Komfo Anokye Teaching Hospital omo dey say be two just say emergency cases e be ba ho no and as e be ba Komfo Anokye Teaching Hospital. Unfortunately no omo ntimi admitting new cases. Inti patient be enya accident and accident see e wo krom Kumasi kwan so ni ahwefa ni pa ne say nkwa no ko Komfo Anokye Teaching Hospital. Unfortunately no, it can't be so. They can't take the person. Why? Because hospital one kasano emergency ward no ayema the best. In fact, they don't have the structures and amenities to consume a patients now. Now, and no, I can say it raised a whole concern. Say how good is our administration and how good is the Komfo Anokye Teaching Hospital handling these cases? And definitely, no, Amavo started berating the National Democratic Congress, the National Democratic Congress, also the Health Minister for their handling of issues at the Komfo Anokye Teaching Hospital. There's been an update about because the Health Minister Minister Akando or the same Biaba Betuja or party say in fact in summer CAF CEO or the Betuja say they can't admit new patients and as emergency ward why any a whole lot of things. So they are not happy because and also consult the health ministry before they come out to kind of bring this particular statement out. A protocol I also follow, and based on this, the health ministry is not happy. So whilst doing investigation, they have immediately suspended the CAF CEO for 2 weeks. Now let's put this on the screens. Or say the Ministry of Health suspends Komfo Anokye Teaching Hospital CEO for 2 weeks for announcing suspension of admission of emergency cases. And this is definitely coming at a time we've seen say the CAF CEO is saying that is the reality on the ground because drive a car and a car equals speed. Now then the car and be accident. Now catch a driver and say, driver, your speed will cause accident and will lead to death. It is not a curse, it is a fact. In fact, they say we don't have the amenities, the space is full, the beds are not there, the services are a bit more run down on the doctors and the nurses. No, also we are overwhelmed. Into our cancer, same way not to say no correct na factor. Instead of the administration and as the health minister looking at ways to kind of solve this issue, he is now moving to suspend the CAF CEO. Now, there's a press release to that statement because Menuka said this in turn have generated a whole lot of buzz. Now, let's put this particular press release on the screens. In summer, the Ministry of Health or EEEII concerned the suspension of this particular CAF CEO. So, as you can see on the screens, the heading here is suspension of the chief executive officer for 2 weeks. Okay, initially it says suspension. It is indefinite and permanent. But until who said the backlash and how it might spark some sort of strikes and I say some sort of repercussions from the Ghana Medical Association. There was so many 2 weeks. Then just say but then this particular press release about within the past 24 hours, it has already triggered a whole lot of ripple effect. Let's put this on the screens. I say there are two screens. So I say suspension of the chief executive officer for 2 weeks. As a pursuant to section 36 clause 1 of the of Ghana's Constitution or of the Ghana Health Service and Teaching Hospitals Act 1996 Act 526, I'm respectfully directing the board to suspend the chief executive officer for a period of 2 weeks with immediate effect for causing to be announced. For causing to be announced a suspension of admissions of emergency cases to the Komfo Anokye Teaching Hospital on Wednesday, June 3, 2026. He will be required to report to me upon the expiry of the 2 weeks. So now, in some minta kando air party said the board of directors, ya track or more, the board of directors for a year the Ghana Health Service and also the Komfo Anokye Teaching Hospital say museo ni suspended no because of in some way to just say emergency cases no they are kind of overwhelmed at the Komfo Anokye Teaching Hospital like they say omuntimi admitting new cases, and that's according to your Minta account was something that omuntias because only penifo na ejuma. There's a health minister there, there's a president there, their MMDC is there. You could just pick the phone and talk to them. You went ahead to do a press release to do damage control and destroy the good name of His Excellency John Dramani Mahama, and this is a no-go area for them. Yeah, trust also the chief executive admitted before me on Wednesday, June 4th, 2026, that he acted contrary to the clear directives of His Excellency the President of the Republic of Ghana by the said announcement. And I told you, say, in some way, one of the things that people are not really happy about is how it painted the president as a person that owned the oil. Because President Biden also build the hospitals or better agenda 111 so near the day. But then one of the biggest hospitals in this country, Komfo Anokye Teaching Hospital, yare and I be too siane do kokwa ubebu, you will die. Oti vox na voxy driver cospinal nemubua, you will die. Why? Because no bed, the emergency ward is full. Into no party side into one country and I walk announce BB at the end of the day. President on one kasa appointed no uguni ni mase inti ya suspended no yet so the meeting was attended by the chief director, the technical advisor, and the legal advisor to the minister. I said before all of this crano Udikan any chief executive officer of CAF no Komfo Anokye Teaching Hospital, they had a meeting no they agreed so a quite fast so announced this no on both parties no omeni anje and there's some sort of reflection which needs to go on. Into no ebeyanka on 2 weeks ni ehwehwe nsem ni ehu bebi nsem no efiba if his narration basically falls in line with the code of conduct and as if it is true or not na yehu the ebeye the way forward. Yeah, trust I also took note of an interview granted by the head of public affairs unit of the Komfo Anokye Teaching Hospital to a Channel 1 newsroom on the matter of the suspension of admission of new emergency cases by the hospital. This announcement by the head of public affairs unit was until contrary to the directives of the president. Into a part say the head of public affairs PA Emma Komfo Anokye Teaching Hospital osanso koye any Channel 1 news for kasa say so some ne kono or must suspend the admission of new emergency cases because of ABCD. Ebra president akacho say obi yedi obi abana nipa ni namebu nipa ni iwu sebio a form one amode ne beto ahwe na mo hwe no because our hospital are sebio ebia parani ebe man no cry bit ma sustain for 2 minutes. It is better than leaving the person home or leaving the person in the car. Ultimately the person will die. That was the president's directive, and now Moshe Komfo Anokye Teaching Hospital ho and mo ye dia mo pe giving your own directives contrary to what the president have directed. Yeah, trust us. I'm also respectfully requesting you to undertake a thorough investigation to establish on what actually he made. I don't know why they wrote this. I'm also respectfully requesting you to undertake a thorough investigation to establish on what authority he made those comments on Channel 1 newsroom. Further, whether it was a management decision for him to grant the said interview, when necessary, the appropriate sanctions should be applied. You are respectfully requested to submit a report to me within 2 weeks. Within 2 weeks. Into a part that says, the board at the Komfo Anokye Teaching Hospital, they should also investigate. Sir, a year interview no yero. Who gave him that authority to do that interview? Injina so ben no jina ya or they can't answer no. We need to know because here for say Pinax ha ye we ye wa ha na bia bibie ni ehu say ye weka baako enenam abafu ntintan videos post near online and ABC addressing things sabio internal matters quickly the person will be fired because you di fear asem ebe kwa abonten so kra na you need to have clearance into no adena way e was say fear asem no yanka nukukuemu yanka nche president ABC na CEO minister of health ABC na CEO se no yamboawa na eche no bitima ye da ka say me de minsem kwa abonten. So at the end of the day about Komfo Anokye Teaching Hospital, the opinfo bi aba, ne de buy no better. The people can't blame Komfo Anokye Teaching Hospital. But in this the case didn't communicate anything. kukuru and then sorry ya one mile cross so straight to channel 1 okay summer anyhow. But then the other point of all of this I'm going to air can say is if you look at this from a perspective now you ha and you who send me course so our rich hospital. In fact, men kai mo yawa ye nua be me emisa ya moto ebo no or driving motor a just say car ebo no ewo eye circle over pass no so a ye de ne call eye rich hospital ye de ne call ye no ye si o hwa fu ye de ne ko Kolebu ye de ne ko 37 ye de ne ko University of Medical Ghana Center echin owu ewo ambulance nim ni nyina ne say no bed and ultimately no it led the Ministry of Health to do investigation. Some investigation no, and at the end of the report, eba say you best sanction doctors be, you best suspend a bimo, and also criminal say a branch needing Charles Emisa. Menuka say Charles Emisa nebusian for issue all the hospitals involved. Amen. Now na so nurses for the into no sabio elimguase and for talking ni ba. Omedi kan akane wo ho because when the life of people na chemi some ba minister ne president omo yi film amaya fa sobo no ambo CAF CEO and a CAF ejumemufo omo nurses ni omo doctors. So that's exactly what is really going on. But then contrary to all of these things are air cost, there's been a ripple effect. Because Minta Kando order this thing, he did not basically read the room. You're moving on to the next. He basically did not read the room.